we're going to talk about types of birth control methods today. And I'd like you to recognize that there are varieties of methods, and some you have to have more thought than others, and some you get them and you don't even have to think about them again for up to 10 years. So we were going to start off with those methods that you use on an every episode base. And so those would include condoms and foam. And condoms actually come in varieties that are specifically designed for women. There are the types that are designed for men. Then there are birth control methods that are used on a daily basis. And those would usually involve birth control pills. Those are hormonal in the method that they work to prevent pregnancy. And some of them actually have a combination of hormones, and some of the common features of a combination pill is that persons will tend to have lighter, maybe shorter menstrual periods. And there's a type of birth control pill that just has one hormone in it, and some of the features of that pill, while there may be some change in the menstrual pattern with some spotting or decrease. Sometimes people after several months don't have menses anymore, but they are protected from pregnancy and they're not pregnant. But those are the types of daily use methods. Then there are some methods that are used on a weekly basis, and that would be the patch. And so that's a hormone method, but it's a patch that's applied to the skin and it's changed every week. There's the method that's used on a monthly basis, and that is a hormone type a method called the ring, which that's used inside the body, and that's placed in the vagina, and it's changed every month. There's a method that is used on an every 3-month basis, and that would be the Depo Metro. So that's a shot of a hormone, but you get that every 3 months, and it prevents pregnancy by the way that the hormones affect the production of eggs, and works very similar to the way a birth control pill would work, or one of the ring or the patch, but you just get the shot every 3 months, so it's something that you only have to actively do something to continue that method on a every 3-month basis. Then there is a method that actually works up to 3 years, and that one is a hormone-based method. It's a subdermal implant called the Nexplanon, and it's a chemical packet. It's a packet of hormones that are placed under the skin, and that placement will prevent pregnancy up to 3 years. But also it's reversible, and if you wanted to get pregnant earlier than 3 years, it can be removed, and then pregnancy could take place. There's a method, the method that is offered by our department here at Public Health. There's a 10-year method of an intrauterine contraceptive called Paragard. It does not have hormones in it. It can prevent pregnancy for up to 10 years. And it's a method that once it gets placed, you will have periodic checking to make sure that it continues to be in place, but you have protection from pregnancy up to 10 years. It's also reversible, and it can be removed if you wanted to get pregnant before 10 years, but that's another option. If you're in need of contraceptions, and we're be happy to serve you at the Public Health Department, you can make an appointment by calling 321-3000. If for some reason you're in the area, you can come in, and commonly we can take people on a walk-in basis as well.